Okay, good evening, everyone. Last day we had completed the philosophy part. Today we'll be starting the chronic disease and the myasins. Okay, write this down. Here there is nothing to explain. In the first edition, the number of medicines were 22. Okay, it was published from Dresden and Leipzig. And published by Arnold. Okay, this first edition, this was dedicated to Ernst von Brunnow. Dedicated to Ernst von Brunnow. Okay. In this one, 25 medicines were added. Okay, this 22 plus 25. 22 plus 25 medicines. This was published from Dusseldorf by Schwab. Publisher Schwab. Okay, tell me after you have written this down. This is just a few basic points. So here there are 47 medicines. Okay, total 47 medicines. Can we move to the next slide? Yes?
Yes, ma'am.
Okay. These are the translations. Okay. This Hempel's edition contains a preface by C. Herring. Hempel's edition contains a preface by C. Herring. Just remember that Hahnemann had disclosed his ideas about the theory of chronic disease to Staff and Gross. Hahnemann had disclosed his ideas about theory of chronic disease to these two people. Okay. Now there are three directions of cure. Head to foot. This was told by Hippocrates. Center to periphery, told by Galen. And reverse order of their appearance, this was told by Hahnemann. Told by Hahnemann. Okay. These were the three directions of cure. Remember this. It has written this. Just note in the preface, no, right. In the preface to different editions, he has told something. In the preface to the third volume, in the preface to third volume, he has given the concept of fractional dose. Concept of fractional dose. Acha, what is a fractional dose? Anyone? What is fractional dose? What do you mean by fractional dose? Tell me. You have never given to any patient, never prescribed. Yes, any one of you, be it right, be it wrong. Tell. Fractional dose is when you dissolve a few globules in like 7 to 20 teaspoonful of water and repeat that water as per need. Okay. The whole dose which you are about to give the patient, you dissolve that whole thing into 7 to 20 teaspoonfuls of water, and that is repeated as per need, be it 1 hourly. You are not giving repeated doses, but you are giving that water. One single dose is like divided. That is a fractional dose. Acha, in the third preface to the third volume, concept of fractional dose, descending potency, and routes of administration were given. Preface to fourth volume, modus operandi. He has told about modus operandi. And preface to the fifth volume, dynamization and use of 50th potency by Hahnemann. Use of 50th potency. Okay, write these things down.
Ma'am,
हाँ बोलो.
uh, within outward was given by Paracelsus.
Hmm?
Um, Direction of cure within outward. Observe by first which one, Galen or Paracelsus?
No, no, these three directions are separate. These are given in as per chronic disease. This you write. Head to foot given by Hippocrates, center to periphery Galen, and reverse order of appearance Hahnemann.
Okay,
Okay.
ma'am.
Ma'am, hello,
Run. Written.
hello, ma'am.
हाँ बोलो.
ये 1847 ट्रांसलेशन जो है लाइक
Yes.
हैंपल का
Write in chat box. I can't hear you.
it's written Germany in the textbook and you have written New York.
You are not audible. Within outward. I have no clue about this. Roberts has said something else that was above downward, important organ to more important organ to less important organ, then reverse order. This is also said by Roberts. Okay, but don't confuse it with these three. What you are telling, I think it is probably written in Roberts.
Ma'am,
हाँ बोलो.
preface third concept of fractional dose के what is written after that? I'm not
Descending
able.
potency. Descending potency.
Okay, thank you.
Acha, is it Germany? But I will check once, okay? I will check once. Don't worry. Then you leave it. I will check once. This Hempel one you are talking about, too. I will cross check it. Where have you seen it? In which text? Is it in any authentic book or in any MCQ book? Where have you seen it? If it is MCQ book, then it is not authentic. Okay. Then I will recheck it because these things I have taken directly from this chronic disease itself. But these things are confusing. Places and all years, it may differ. So I will once check it and then I will tell you.
Ma'am, it's written chronic was from German. I think it's language. It's talking about language.
Just a second, just a second. I can't hear you. Just give me a minute. Tell me, someone was telling something.
Ma'am, I was saying that it is written second translation of chronic was from German. They are talking about language, not place.
Okay, okay. Then it will be this one only because these things are facts are already checked. But since you are having queries, I will recheck once. No problem. Okay, it was in German language, not the place. You write it New York, no problem. If you have a doubt, just put a question mark. I will surely check it once again and I will let you know. Okay. No need to waste so much time for this Germany or New York. Done. Then we're going to the next part. We have a lot more important things. Done. Yes or no?
Yes, ma'am.
Okay. Acha, Sora. Very, very important. You all know. Before we come to soda, have you ever heard of Occidental soda? This came in Ames question paper. What is Occidental soda? Any idea? Malignant erysipelas was also known as uh, this Occidental soda or Saint Anthony's fire. This is very important. It has come once, it can come again. It was also known as Saint Anthony's fire. Okay. Form of leprosy. Remember that soda is a milder form of leprosy. Okay. So from malignant erysipelas, then leprosy, then soda. So this is the milder form of soda. I had once got a question from a student that what is the mother of soda? Now we all know that soda is the mother of various chronic diseases. At first, I could not understand the question. I thought maybe he or she was telling it wrong. The question maybe they were stating it wrong, but actually it is not. Though soda is referred to as mother of chronic disease, but soda is the milder form of sorry, this will be milder form of leprosy. Milder form of leprosy. So leprosy can be referred to as mother of soda. Mother of soda. Okay. Remember that soda is the miasm uh, which is the which is treated in the worst possible manner. Treated in worst possible manner. Fine. Okay, what are half acute miasms? This you should know. What is half acute miasm?
Hydrophobia.
Why it is known as half acute miasm? Because it has taken effect in the moment when the person was bitten, and after the person is infected, whatever numerous times of numerous times you wash it, it will not go away. It has taken effect the moment the person was bitten. That is why it is known as half acute miasm. Okay. Acha, how is this soda transmitted? These things are very basic. This you all know. How is it transmitted from person to person? Tell something. Syphilis is transmitted via impure coition, we know. How is soda transmitted? See, if you don't say anything, I will take it that you are not interested. You have to say something. Person was bitten, bitten. B-I-T-T-E-N. Dog bite, bitten. Tell something, tell something.
Inherited.
Inherited. No. Acha, before that, just tell me which one is the most contagious miasm among soda, syphilis, and psychosis. Which one is the most contagious? Most contagious. Ah,
Psychosis.
psychosis. No. Soda is the most contagious because it needs only touch. It requires a certain amount of friction in the most tender parts of the body, which are rich in cuticle. Touch. Only it is infected by touch. Touch the general skin. Touch to the general skin. It requires a certain amount of friction in most tender parts of body, which are rich in nerve supply. Now, this may go on. Suppose the doctor, what Hanneman has told, the doctor is checking the pulse of a soda patient, and after that he checks a healthy patient. That healthy patient may be transmitted like that. Okay. You know that the first manifestation of soda is the voluptuous tickling itching. That is the primary manifestation, voluptuous tickling itching. And if the itching is so violent that if the patient does not scratch, like he restrains himself from scratching, a shudder passes through the whole body. At first, the vesicles of the itch contain lymph clear as water during the initial hours. Vesicles of itch contain lymph clear as water but this changes into pus, which fills the tip of the vesicle, sorry. And soda, without the help of medicine, it will never be eradicated from human body. Okay. However, like good you maintain yourself, however quality of life you may have, but without medicine, it is never eradicated from the body. We will again take up when we are discussing the myism, the manifestations of myism, but for now, this is all. Acha, tell me after you have written down. This is also this voluptuous tickling itching, which is unbearable. Unbearable. It is also known as grimen. 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 Okay. Acha, written. Done.
Yes, ma'am.
Okay. Syphilis. Syphilis is easy to cure or it is not easy to cure? What do you think? Hmm?
Easy.
Easy. Sure.
Psychosis is more tough.
Acha. Psychosis is more tough. What about soda?
Comparatively easy.
Comparatively easy. Okay. Syphilis is the most curable, and no myism is more easily curable than syphilis. He has said that on earth there is no chronic myism, no chronic disease which is more curable. This is the most easily curable. Most easily curable. Okay. Acha. In case of syphilis, the bubo will come first or the chancre will come first. You know the primary manifestations. I'm not going over there. The bubo will come first or the chancre?
Anchor.
Chancre. Okay. So the bubo will not come first. The chancre will come. When this chancre, it is destructed by local applications. Then the bubo comes. Destructed by local application, then you will see the bubo. Okay. Achha. Now we will discuss three different cases, how we are going to treat syphilis. First one is when this chancre is still present, when it is not destructed. There is no complication with soda. So the chancre is present and it is not complicated. No complication with a developed soda. No complication with a developed soda. So here, only one little dose of mercurial remedy is needed. And within 14 days, it will be cured. Within 14 days, this will be cured. Fine. Okay. Second case. Chancre has been destroyed by local application. Chancre destroyed by local application. Okay. So here again internal cure by mercury. Internal cure by mercury. Now the chancre is not there. How will you understand whether the syphilis has been cured or it has been suppressed? How will you understand? See, here we can have two cases. The chancre had already been destroyed. Now you are giving internal medicine. One case is that at the spot of the chancre, there will remain a discolored scar, red or blue scar. A discolored red or blue scar. Which means that there is no cure. On the other hand, if you get that no discoloration is there, the spot looks just like normal skin, that means this syphilis, this has been cured. This is the differentiating feature. Okay. Third case, when it is complicated with developed soda, it will be complicated. Complicated with developed soda, Hahnemann has told that it is impossible to cure syphilis alone. There you have to start with and giving antisodic medicine. Okay. So first antisodic, then mercurial preparation, and again last antisodic. So here you cannot cure syphilis alone. Okay. Another case may be there. You will tell me the name of this. Syphilis plus condylomatous gonorrhea or it is last mercurial, then again last antisodic. Okay, plus large dose or large doses of mercurial preparation, mercurial affection, or complicated with sodic manifestation. What is the name of this condition? What do we tell? Syphilis plus condylomatous gonorrhea or large doses of mercurial preparation leading to mercurial affection or sodic manifestation. What is it known as? Aphorism 41. Uh-huh.
Complex disease.
No. Aphorism 41. What is there? Never heard of masked venereal
Masked
disease?
syphilis.
Masked venereal disease. Venereal disease or pseudosyphilis or spurious syphilis. What will be the medicine in this case? What will you give? Here it is better to give treatment is hepasulf rather than sulfur. You should give hepasulf. Okay. Acha. Suppose soda, syphilis, psychosis, all three together are complicated. Which medicine will you give at what time and why? First, what will you give? Soda, syphilis, psychosis, all three are there. What will you give first? Again, no answer. Are you not listening? Antisodic. Then
Antisoric, antipsychotic, antisyphilitic, then antisoric again.
listen, this antisodic is the first thing. Antisodic you will give first. Then you will see that which psychotic symptoms are more prominent or syphilitic symptoms are more prominent. Based on that, you are going to decide whether you will give antipsychotic or antisyphilitic. Fine. Then the next one. Not blindly antisodic, antipsychotic, antisyphilitic, not like that. Antisodic is the first. After that, the prominence of symptoms will guide you towards the remedy. Got it? But if you see the psychosis part, there, since it is related to psychosis, so don't go by that. Since the chapter is psychosis, there Hahnemann has told that after antisodic, you have to give antipsychotic, after that antisyphilitic, because he was discussing psychosis at that chapter. Again, syphilis, he will tell that after antisodic, you will give antisyphilitic, then you will give antipsychotic. Got it? If you go through the text, you will find that in psychosis chapter, he has told first antisodic, then antipsychotic, then antisyphilitic. That is just because he was discussing that chapter at that. Okay. Acha, have you written this down? Then we'll go to the next one.
In last, antisoric is also given to complete the cure.
Huh. That I have already written now. Last antisodic is given.
Okay.
Done. Written. Okay. Psychosis. Okay. Here there may be two cases. Okay. Gonorrhea plus figworts. There you will have to give puja alternating with nitric acid. In this case. Puja alternating with nitric acid. But other types of gonorrhea where it is confined only to the urinary organs. There, Hahnemann has told about a number of medicines. One is parsley or petroselinum. Petroselinum, cannabis sativa, not cannabis indica. Huh? Though you will tell me, if you go through the text, you will tell me that it is written only cannabis. But if you go through the text of cannabis sativa, there it is mentioned about gonorrhea. Cantharis and copaiba. These are the medicines he has told about urinary types of gonorrhea. Okay, this is the only case where he has permitted the use of external applications in the most inveterate and difficult cases. Most inveterate and difficult cases. There you will give pure juice pressed from green leaves of thuja. So pure juice of thuja, pure juice of leaves of thuja, plus mixed with an equal quantity of alcohol. Equal quantity of alcohol. Fine. Okay. I will ask you a question now. A patient has come with SORA's original manifestation, primary manifestation. It was there. He has not come to you with the primary manifestation. Okay, wait. Which one? Which last point? External application. Okay. External application, it is that in difficult cases, this is the only case where Hahnemann has permitted use of external application. In that case, when the fig words are not going, it is very stubborn, staying on the skin, then what you can do, you can give pure juice of leaves of thuja, which is mixed with equal quantity of alcohol. You can apply it to the fig words. Okay. Acha, tell me now. A patient has come to you, original eruption was there, he had did something with that, what to say, with that eruption, he had done something, and that had disappeared. Now you are giving some medicines, and an eruption has again appeared. Should you be happy or not? The eruption of soda was driven out from skin by some external application, by some local application. Patient comes to you, you give some medicine, and the eruption has reappeared again. You should be happy or not in this case?
Yes, ma'am.
You should be happy. You should not be happy. No, it's not a good sign. Why? When you read thoroughly the chronic disease, you will be able to know a lot of new things, I also came to know that Hahnemann has told he was also very happy, like you people. Then, what he noticed was that, so if it is a good sign, then I will try to bring it to the surface to silence the internal malady. He did some weird things to artificially to bring that eruption to the surface. After that, he noticed that this secondary eruption, the eruption that comes second time, okay, which each if reappears after the development of secondary symptoms, it is not easy to cure and it is very unreliable. You cannot hope on it. You cannot expect any cure from it. Understood? Each if reappears after development of secondary symptoms, neither it is easy nor it is reliable. So it is not a good sign. Okay. I'll write it here. Not easy to cure and neither it is reliable. Not reliable. Okay. Now, can you cure old soda, by sulfur alone? Yes or no? Sulfur is one of the medicine. You have to give sulfur at some point, okay? Is it possible to cure? Yes or no? Yes or no? Tell me. Yes or no? You cannot tell. Can you cure this old soda by sulfur alone? No. What will you give them? After you have given sulfur, where the cutaneous eruption is still present, in that case, still present in this case, still present cutaneous eruption. After giving sulfur, within 2, 3, or 4 weeks, you will give carboveg. 2, 3, or 4 weeks, you will give carboveg. And after that, highly potentized sepia. Highly potentized sepia. Fine. Okay, now few restrictions what he has told during the treatment of chronic disease. Then we will go back to the miasms. Okay. What should you tell the patient when you are treating a chronic disease? Complete bed rest or daily work should be continued, exercise should be done. What should you tell? See, if you don't interact, it is going to take a lot of time. Please tell so that we can complete fast. We have a lot of things, and I heard you are having exam next week. Mock test you are having, na? So tell something. Studying, reading, it can never be a one-way exercise. Okay. I will like go on blabbering something, you will not listen. That is what will happen. That is why I ask you to interact. You should have an opinion about everything, even if you have studied the chronic disease or not. You should have an opinion. You will advise complete bed rest or not? Yes or no? There is nothing to feel bad even if you answer something wrong. No one is ready to communicate in this class. Very few people. After I tell you, then only one message will come. Last session, last year's session was very interactive. That is needed. At least for MCQ, the more we discuss, the more we interact, the more this whatever wrong ideas we are having, it will get corrected. Otherwise, you will read, you will forget. That is what will happen. Okay. So, not complete bed rest. Fine. Sedentary persons should work. Moderate exercise. No, not complete bed rest. Okay. Daily work should be continued. Continue daily work. Walking in open air, all these things are given. But one thing I will tell now, you will tell that ma'am is telling this. Tiresome lectures, which are very fatiguing lectures, that is not permitted. Okay. Even mental stress, then straining the memory, reading, all these things are prohibited. In mental disorders, it is never allowed. Straining the head or straining the memory, that is not allowed. Okay. Intercourse between married people, should it be allowed or not? Intercourse among married people, these things come. That is why I am straining on these things. All these things will come. Intercourse is not prohibited. Intercourse among married people is allowed. Okay. Then woolen should be avoided. In place of that, cotton and linen are permitted. Woolen avoided. Cotton, linen permitted. Coffee is forbidden. Chinese tea is forbidden. Coffee, Chinese tea, forbidden. Wine is forbidden, yes or no? Wine is allowed or forbidden?
In a small amount, it is allowed.
Wine is allowed. See, though Hahnemann was at that time, he could not explain with our technical terms. But if you read this part, okay, don't be happy that he has what we generally what we say wine was his favorite, that is why he allowed. It is not like that. He was concerned about the withdrawal symptoms. Okay, so if you stop wine suddenly, then the patient will deteriorate. He told that is why wine is not, though you will not find the term withdrawal symptom, but the ideas are like that. Wine is not totally forbidden. It should diluted and taken. After that, the patient will not have withdrawal symptoms. But whiskey and brandy is forbidden. Whiskey, brandy, forbidden. Okay. Smoking, for the same reason. Smoking in some cases is permitted. Okay, those who are having scanty menses, ladies with scanty menses, these things come. They should avoid use of saffron and cinnamon. Persons with weak stomach, they should avoid cinnamon, clove, pepper, ginger, bitter substances. Okay. Those who are having constipation, baked prunes. Acha, this scanty menses, this is very frequently asked. Baked prunes should be avoided in case of persons who are eating, who are having this constipation. Those people who are having low sexual powers. They should limit eating young chickens and eggs. Young chicken and eggs. Okay, all these things are given. Acha. This part is extremely important. This comes, which is totally forbidden, which is not. Okay. Another thing, if the soda is latent, and if we talk about some triggering factors which brings soda to the surface, most important of them is uninterrupted grief and vexation. Most triggering factor to bring latent soda to the surface, most frequent excitement of latent soda, it is caused by uninterrupted grief and vexation. Interrupted grief and vexation. This is the most exciting factor to bring soda to the surface. Okay. He has told they are the most active destroyers of life. Okay. Suppressed sexual desire. That is an obstacle to cure chronic disease. One is this one. And this suppressed sexual instinct. This is one of the obstacle to cure chronic disease. He has told about this. Whatever I am telling, everything is from chronic disease. Okay. Another question that you may be asked is, for how many days you will allow the antisorics to act? Antisoric should be allowed to act for 30, 40 and 50 days. 30, 40, 50 days. Okay. Homeopathic aggravation, I'm writing it over here. Homeopathic aggravation, this may come after 16, 20 or 24 days after taking a dose. It may also happen that after 16, 20, 24 days of taking medicine, it may come.
Ma'am,
हाँ बोलो.
antisoric should be allowed to act for this line
50
without
days.
repetition. Without repetition.
हाँ, the first dose.
Okay.
Okay, done. For a few more points left from chronic disease, will be done. Have you written this? Write this down. Achha, here you will find that invaluable gift of God. Sugar of milk has been told invaluable gift of God. This comes, Hahnemann has told it. Invaluable gift of God. He referred to sugar of milk told by Hahnemann. This is important MCQ pointer. Who told sugar of milk as invaluable gift of God? This comes. Okay. What is the best time for taking a dose of antisoric medicine?
Early morning in the empty stomach.
Ha. After taking the medicine, should you sleep or you should be active?
Active.
Patient should remain perfectly quiet for an hour. After antisodic, acha, this you all know, empty stomach early morning, I'm not writing it. After antisodic, patient should remain perfectly quiet without going to sleep for 1 hour. चुपचाप बैठे रहना for 1 hour, but without going to sleep. Okay. As I told last day, should not be taken before their menses are expected in case of females 4 days or 96 hours after menses have set in. That means after day 4, from 5th day, the patient can have. Okay. Now, in case of females who are having premature or too profuse or too long-lasting menses, too profuse, too long-lasting. In case of them, it is necessary to give Nux vomica small dose on 4th day. Nux vomica on day 4. And if the female is following this, you will give on the 4th or 6th day antisoric. After this, after day 4, again you have to wait for 4 or 6 days. The antisoric is given. In case of sensitive or nervous persons, nervous female, again this same Nux vomica can be given on day 3, 72 hours. Day 3 after beginning of menses. So this is the exception. Okay. Acha, to correct sodic diathesis of newborn, what is given?
Organon.
Sorinum, not sulfur, no? Acha, write this, then we'll go to the next part. Done. Remember that if soda is developed, no miasm can complicate it. But if it is latent, other miasm can complicate it. Okay, are you done writing this? I'll go to the next slide.
Invaluable or gift of God.
Sugar of milk. Sugar of milk was referred by Hahnemann as invaluable gift of God. Write the whole thing. Sugar of milk, write whole thing. Don't write like me, then you will not understand later on. I'm going to the next slide, okay? Achha, very important. Observations of Ludwig Christian Juncker. He has seen that suppression of itch in different conditions result in certain diseases. Okay. Suppression of itch, and this is the result. First condition is sanguine temperament in young people. This leads to phthisis. In young people, phthisis. But generally, sanguine temperament, if itch is suppressed, it will lead to piles, hemorrhoidal colic, and renal stone. Hemorrhoidal colic. Okay. Then sanguino-choleric temperament. Sanguino-choleric temperament. There will be swelling of inguinal gland. Stiffening of joints and malignant ulcers. Fine. Phlegmatic person, dropsy. If it is suppressed in menstruation time, it will lead to delayed menses, hemoptysis. Okay. Melancholic person, insane. Pregnant women, fetus will be killed. Fetus killed. Menses after na menstruation time, delayed menses, hemoptysis. Okay. Acha. In case of women, if in general each is suppressed, it will lead to sterility. Nursing women, milk, menses, both will disappear. Milk and menses disappear. And in older women, cancer of womb. I'm writing it over here. Older woman, cancer of womb. In case of fat persons, there are a number of conditions if this itch is suppressed. Inflammatory fevers, inflammation of lungs, inflammatory fever, inflammation of lungs, mucus consumption, and acute pleurisy. Acute pleurisy. Okay. So write it and tell me after you are done. Nursing women, milk and menses disappear. Women in general, sterility. Melancholic person, insanity. Is insanity. Fat person, acute pleurisy, mucus consumption, inflammation of lungs, and inflammatory fever. Anything else? Horrible handwriting. Mine. Done. Okay. Good. Write these three mistakes in case of treating chronic disease. There is a term known as liaison psychiatry. It is simple physical problem due to psychiatric conditions. That is known as liaison psychiatry. Physical problem due to psychiatric conditions. Okay. Be fast. Done. To write 4 lines, how much time will you take? Good. Now, the most important thing, you get a lot of questions from here. Whatever manifestations you get, everything is from Roberts. If you read Roberts thoroughly, no need to read anything else. You have to understand the miasm. After psychiatric, physical problem due to psychiatric problems. Okay, and this is my favorite part of the organon. I just like it like anything. Okay, I'm coming to this part. First, disease classification. Okay, Hahnemann had classified disease into 4 great divisions. First were all the diseases that came out from mechanical and exterior sources. This included fractures, then strains, then indiscretions of diet or problems in diet, then external poisons, and extreme thermic conditions like sunstroke or frostbite. Okay. Now these are generally self-curative in nature. Self-curative. It is generally rectified by regulating environment and habits. If you regulate environment and habits, generally it is cured. And if you use medicine, it will assist and hasten the recovery. Medicine hasten the recovery. Okay. To the 3 remaining groups, Hahnemann gave the term miasms. This is the definition, common definition. Miasm is defined as polluting exhalations or malarial poisons. Okay. Just I will tell you one more thing over here. I will first start with psychosis. Psychosis, the word origin, this is important. It came from Greek word. This word origin is extremely important. It comes, mark it. Greek word origin, which means fig. And psychosis is Hahnemann's term for constitutional effects of gonorrheal virus. Hahnemann's term for constitutional effects of gonorrheal virus. Remember this term constitutional. Sorry. Now, why psychosis is known as psychosis and not as gonorrhea, that we will discuss later on. First, you write this.
Regulates environment of
Environment and habit. Done. Write fast. Medicine hasten recovery. The recovery will be quicker if medicine is given. Please be a little bit fast. Done. Good. Okay. Write this, then we will discuss. Please write fast, huh? Done. What origin is from the Hebrew word? This comes sorat, and soda relates to deficiency. Okay, so lack of certain elements in the system or the inability to assimilate. This is the common denominator. Soda is in one word, deficiency. Now, please pay attention. It is the source of almost all subjective symptoms. Symptoms that are like sensations as if. Okay. In case of venereal diseases, that means other two, psychosis and syphilis, if the subjective symptoms are present in those two, it will be in the degree in which soda is present in them. If the subjective symptoms are present in case of venereal miasms, it will be in the degree in which soda is present. Okay. soda, in case of soda, skin is the natural place for different manifestations. Okay. So skin is the natural place. Natural place. Apart from that, you will get swelling of glands, sarcomatous and carcinomatous tumors. Carcinomatous and tumors. Fine. Then suppuration, functional disturbances. Remember that soda only has functional disturbances, no deformities, nothing. Soda is always on the functional plane. No deformity. Fine. Achha. This slide is completed, yes or no?
मैम ये पॉइंट वेनेजल सब्जेक्टिव मैम इसको एक बार एक्सप्लेन कर दीजिए ना
What are the subjective symptoms? First, you tell me that.
which patient
Experience by
tell with
patient himself.
Ha. This, whenever we have sensations as if throbbing sensation, biting sensation, cramping sensation, all these sensations, these are all subjective symptoms. Okay. These subjective symptoms is generally limited to soda. Now, you may find a patient who is having some psychotic symptoms as well as this sort of sensation as if symptoms. What I will tell in that case is that in venereal diseases, if subjective symptoms are present, in case of psychosis and syphilis, if subjective symptoms are present, it will be present in the degree in which the soda is present in that person. Along with psychosis and syphilis, soda is present, and that amount of soda that is present, the degree in which that soda is present, will determine how much the patient will have subjective symptoms. Okay.
okay yes ma'am
Acha, complete. So I'll go to the next slide. These things are very important. Okay. Numerous sensations of vertigo are there. This vertigo, they are generally induced or aggravated by emotional disturbances. Aggravated by emotional disturbance, very important. Okay, these are brought on, the patient is generally aggravated from any kind of motion, walking, motion, looking like brainia. Okay, so any kind of motion will aggravate, and the patient has a desire to lie down, keep quiet and lie down, which ameliorates. So complete rest ameliorates, and any kind of motion it aggravates. Desire to keep quiet and lie down, that kind of rest. Okay. Then see the headaches, see the location, frontal, temporal, or parietal. By seeing the locations only, you will be able to differentiate the miasms. If it is a syphilitic headache, syphilis headache will be either on the back of head or one side. Back of head or one side. If it is a psychotic headache, then it will be either vertex or frontal. So by the location of the headache only, you will be able to differentiate. Achha. Note that this desire to keep quiet and lie down, this is characteristic of sodic state. Desire to keep quiet and lie down. This is the general tendency of sodic patient. This is very characteristic. Okay, very important. Now, Vertigo, another cause of vertigo is different bilious causes, like brainia. Acha, headaches. These headaches are ameliorated. One to is rest, quiet sleep. Another is hot application. Anything ameliorated by hot application is soda. Headaches are ameliorated by hot application. Okay. Psoric head is normal in size and contour, unlike syphilitic. Here you will get a general dryness. Then this hair is very lusterless, dry. It will break out. The patient cannot comb it properly, and hair falls out after illness. Hair fall after illness. There is premature graying. This is another important question. Premature graying is psoric miasm. Premature graying and hair fall after illness. There are the scalp, it appears very unclean, very dry. There is much itching, dandruff. Okay, all sorts of dry kind of symptoms. Unclean, then dandruff, all these things. Various dry eczemas on the scalp, all these things will be there. Now, as I told you, psoric patients are very sensitive, but they do not have any deformities. In eye symptom, they will have spot before their eyes and they are intolerant of daylight. Just note that everything is on the functional plane. Ear also, there is characteristic oversensitiveness, but the appearance of ear is normal. Okay. Face. Shape of psoric face is that of an inverted pyramid. This comes very often. Very, very important. Skin of face. Skin, it is naturally dry with an unwashed appearance. Dry with an unwashed appearance. Okay. Nose, the patient, as I told, will be oversensitive to everything. So oversensitive to odors. Lupus of the nose. Remember that lupus is a manifestation, lupus of nose is a manifestation of combined miasms closely allied to tuberculosis. Closely allied to tuberculosis. Acha, ptosis. Ptosis is psoric or syphilitic? Ptosis. This comes, huh? Ptosis. Psoric or syphilitic? Tell me. Yes, very good. Ptosis is syphilitic. Okay. Red lids. Red lids is a combination of red lids. It is a combination of psoric and syphilitic in the tubercular diathesis. Whenever you find anything red, it is generally tubercular diathesis. Red lips, flushing, all these things, red spot, all these are tubercular diathesis. So red lips, it is a combination of soda and syphilis, tubercular diathesis. Very good. Everyone knows about ptosis. I'm so happy. Okay, write this, then we'll go to the next one. Lupus of nose, it is due to combined myasm, and it is closely allied to the tubercular myasm, tubercular diathesis. Done. Done. Okay. Write this, then we will discuss. Done. So what is sawdust? You have written. Okay. What is sawdust? What is the meaning of this term? It is any collection which is having bacterial or food particles. Okay. Achha. Cravings of sweets. Craving for sweets, it is sodic. Craves acids, sweets, and sour things. In fevers, they crave indigestible things. Now note that in soda, there are many taste perversions. Many taste perversions. There are a bad taste in mouth. It may be sweet, bitter, sour, various taste perversions. But soda is the only miasm to have burnt taste. Burnt taste. Only miasm to have burnt taste. Okay. Along with taste perversions, there are also regurgitations. Regurgitations. Okay. Though generally there is craving for sweets in fevers, soda people they will have aversion to sweets and crave acids. Aversion to sweets and crave acids. Okay. Soda patient, remember that soda patient is always hungry. always soda patient is hungry and there is a weak, gone feeling in the stomach, but most of the soda aggravation occurs after eating. Weak, gone feeling in stomach, and most aggravation occur after eating. Okay. In bilious attack, in case of bilious attack, before having this bilious attack, the soda patient will have a lot of sweets, craving for sweets, and the patient takes a lot of sweets before. Now, it may seem to you when the patient comes that since the patient has taken so much of sweets, that is why he or she is having bilious attack. But it is not the case. This craving for sweet, this is an indication of the soda. This is an indication that this attack will happen. This craving is a forerunner of the attack. Craving is a forerunner of the attack. Okay. It can also be told as a prodromal symptom in case of this attack. Okay. Now, since we are discussing with various desired food aversions, note that soda has desire for meat. Tubercular myasm has aversion to meat. Okay. Soda likes hot food. Syphilis likes cold food. And psychosis likes wants food either hot or cold. Either hot or cold. Okay. It's written. Done. Okay. Yeah. Cough is dry, teasing, spasmodic, and annoying. Note this, the expectoration is mucus, scanty, and tasteless. This tasteless is very important because if the taste of the mucus, taste of expectoration is salty or sweetish taste, then it is due to tubercular, sodic plus syphilitic. Sodic plus syphilitic. Okay. And this will be die. Sodic patient always fears that he will die from heart trouble but lives long. This is very important. he tells that Roberts tells that sodic patient is so anxious, he's having so palpitations and pulsations that he will be constantly checking his own pulse. Constantly checks his own pulse. But he will not die from heart troubles. He tells that sodic patient is a kind of a person who will produce a steady income for the physician. Okay. The patient is having so much pulsations that it will shake the whole body. But those who are not having an indication dying suddenly from heart trouble, those belong to psychotic and syphilitic group. This has come in last UPSC, no, not last UPSC, UPSC 2020. So psychotic and syphilis, they will die suddenly from this heart troubles without any warning. Okay. Then diarrhea. Diarrhea is induced by overeating. Generally, it is a aggravation in the morning, and this diarrhea corresponds to diarrhea of allopodophyllum and sulfur. Allopodophyllum, sulfur. Okay. But remember, this diarrhea is not persistent. Soda patient is not having persistent diarrhea, but the soda patient has persistent constipation. The constipation is persistent. Persistent constipation. Though the patient is tend to have diarrhea, he is very hungry, as I discussed in the last slide, hungry and can eat well beyond capacity. Hungry eats beyond capacity. Fine. In the skin, there is an overall unwashed appearance. And urine symptom is there is retention of urine when the person gets chilled. Retention of urine when body gets chilled. Okay.
From previous slide.
Uh-huh. Two or three few more points. That the sodic patient cannot stand like sulfur. Even if he stands, he will lean on something because it is his natural desire to rest. It's in his nature, the desire to rest. And this is characteristic. It is present with characteristic restlessness. Characteristic restlessness. Okay. Achha. Two or three more very important things. This came in some MCQs, I don't remember. Erysipelas. Erysipelas is soda plus psychosis. Then impetigo. Soda plus syphilis. Weakness of ankle joint. Soda plus syphilis. Weakness of ankle joint. Soda plus syphilis. Okay. Please be a little bit fast. Let us at least complete soda today. Okay. Achha. Mornington has given list of antisoric remedies. There were 50, 16 from vegetable group, 1 from animal group, that is sepia, and 33 chemical elements. Now, among all this, only 3 are those which have higher atomic weights than those required to construct our human body. The elements that are required to construct our human body, uh, leaving these 3, rest are in that range. Only 3 are there which is having atomic weights higher than those elements which are essential for our body. Okay. Remember that radioactive elements generally they belong to the antisyphilitic group. Okay. Achha, here these 3 are baryta carb. Since it is related to the carbons, so it can be told as antisoric because of the carbons. One is platina, another one is aurum. Okay. Important among this, it came in some question, that manganese, whenever it is in human tissue, it is generally accompanied by iron. This deficiency of manganese, it is very important. They will just give you the symptom. You will think that it has come from some biochemistry question, but it is actually organon question. What will this deficiency of manganese do to the body? Generally, it brings on sterility in male, and loss of mother's love in female, loss of maternal instinct in female, loss of mother's love in female, loss of maternal instinct in female. Clark has brought out the first mental symptom of this. J.H. Clark, he has given the first mental symptom for this manganese: peevishness and taciturnity. Peevishness and taciturnity with concentration in self. With concentration in self. Okay. Teen. Teen is related to sense of taste. Okay. Cobalt and nickel. If these are deficient, it will lead to diabetes mellitus. Okay. Tell me after you have written this down. Done. So now, before we, I don't think we'll have the time to on. Just tell me, do you have any queries? Queries from this part? Peevishness, I'm telling, and taciturnity. Peevishness and taciturnity with concentration in self. Peevishness and taciturnity with concentration in self. Taciturnity means not willing to speak. चुप रहना. Done. Okay. Now tell me, do you have any Queries on this part? Till here, any queries? Mother of soda. See, soda has its origin from leprosy. Okay. Soda is the milder form of leprosy. First malignant erysipelas, then leprosy, then soda. So mother of soda, if we refer to mother of soda, it will be leprosy only. Okay. Got it? Anything else from this miasm part? Go through the questions. Are you going through the questions? Then you would have like gone through something which is not covered in this. You have never got a question like this. Everything is common. Got this type of questions. Whenever you are going through this question papers, just go through the notes. If it is common in the notes like the way I put a Q beside it, you just do that. That way, when you will revise, you will just come to know which is important, what can you overlook and what can you not, where to give more importance and where to not. Okay. Anything else? Bolo, anything else? Next day, first we will complete this miasm, Latin soda, syphilis, psychosis. Then we will go to the aphorisms. Okay, after we complete the aphorisms, organon will be over. Okay, anything else? Anyone? Neither we will stop over here. Thank you all. Good night.